So in the past 20 or so years, the EMS community has all been saying to people, if you need us, call 911. Doesn't matter what it is. We're going to be there for you. And I agree with that statement. But at the same time, that has increased the call volume exponentially, leading for a lot of EMS providers to burn out and leading to hospitals, EDs, emergency departments, to be overwhelmed with patients with lower acuity complaints.
You're listening to Cold Press Conversations with Dr. Jewel White Williams, a lover of numbers, lists, and a good glass of cold press juice, who is sharing episodes each week to help you explore the back end of healthcare and health sciences, where a lot of that grit is done. We'll dive into topics covering research, education, and clinical practices, as well as guest shows with other leaders in the field. Pull up a seat and let's dive into these amazing and game-changing conversations. Hello and welcome to Cold Press Conversations. I am Dr. Jewel, and I am your host of Cold Press Conversations, a place where I amplify the voices of medical and health science professionals, focusing on research, instruction, as well as clinical practices. And today we have the guest. I want you to meet Alex Este.
Aste.
Aste. See, I told you I was getting close. Excellent. Well, I'm happy to have you here. I really, really am. Thank you for joining me.
Thank you for having me, and thank you for reaching out. I really appreciate it, and I'm honored. Thank you very much.
Oh, it's my pleasure. And I want to tell everybody, if you have not joined LinkedIn, it is the place to go for professionalism. To learn more. People are vetting people. People are fact checking. We're making sure we're getting solid information, and we're making sure we're meeting the needs of our community there. And this is where I met Alex. All right. Now, I just want to give you all a little insight about where Alex is from, who he is, what he does, and why he does what he does. Like, I got to give you all that insight. Let's meet Alex. He is originally from Italy, now making waves in the United States. He pursued higher education at Purdue University Global, earning a Bachelor of Science degree in Fire and Emergency Management, followed by an MBA with a focus on finance, managing and maintaining a stellar GPA of 3.9 throughout. With a career in EMS began at the age of 18 in Italy. Alex's commitment to public service was evident early on. Upon relocating to the U.S., Alex joined Acadia Ambulance in Houston, swiftly climbing the ranks to become an operations supervisor, overseeing 100 plus direct reports, leading internal projects and maintaining and managing medical operations at Minute Maid Park for the Houston Astros were just a few of his highlights. His contributions at Acadian Ambulance garnered prestigious awards such as Medic of the Year Awards for Texas in 2018 and the American Ambulance Association Star of Life Award, leading to invitations to the United States Capitol and the White House West Wing in June 2018. Oh, we're talking some impressive stuff here. Currently serving as a clinical education specialist for AMR Santa Clara. That's in California. He plays a pivotal role in conducting clinical investigations, implementing new programs, and advancing EMS practices with a background in finance and real estate, coupled with extensive EMS experience. Alex brings a unique perspective to analyze and evaluate EMS systems effectively. Welcome.
Thank you. It's very humbling. I really appreciate it.
Thing go, shh. I'm gonna have to get some. I'm gonna get a bell. I'm so excited.
Thank you.
And I don't know if you've heard before, but when I read and review a lot of the information after I've gotten my guests, my intention is to really read your biography. And I'm like, oh my gosh, you've done so much.
When you do something you love, it really doesn't feel like it's that much. That's my thing.
Love it. Okay, listen, I don't know if people caught it, but I'm a teacher by trade, okay? And I have something called a warm-up or a do-now question. So my do-now for my audience is for you to think about what I'm warming you up to. So Alex, before we dive into this impressive career, I just want to start just a little bit on a lighthearted note. You are from Italy, right?
Correct. Born and raised,
and you came to the United States. So that's a huge transition. Mm-hmm. Let's say, what do you miss about Italy?
The food. Absolutely the food. 100%. But I do get to go there relatively often, maybe twice to 3 times a year. My parents still live there. They're about to retire. So it's always the perfect excuse to just travel back.
Yeah, definitely. You got to see mom and dad.
I know. And they come here too. So we see each other every couple of months. We do travel quite a bit.
Oh, excellent. Do you think the way of life over there is different than it is here?
Yes, absolutely. Over there, it's a lot more relaxed. Here, it's just rushing everything, meeting the next goal. Like, barely any time for a break too. But over there, it's just a lot more relaxed, especially the area where I'm from. I'm from Northwest Italy, living on the coast. Everything there is just a lot slower, a lot more relaxing.
Oh my gosh, it sounds beautiful. It really does. And the reason I thought I could just go ahead and talk about that is because when you're in Italy, and I've never been overseas, I have no problem saying that. A lot of people are embarrassed. I'm not. I wanted my daughter to gain the experience of being overseas, and I gave that to her for an entire semester. But one thing that I do know is that when I did my dissertation, a lot of the studies and research studies that I gathered were from overseas in Europe, as well as Australia and other areas. And the reason I asked that first, do you feel like your perspective of being in Italy has influenced how you work here as an EMS provider, maybe approaching maybe the problem solving of how you're working with our community?
Yes, yes. Well, there are also very different challenges as well between Italy and the United States. But having garnered this experience since I started my career as a medic over there in Italy, to have this more international perspective and knowing the different protocols and the way things get done overseas in different countries. Each country in Europe does things differently. France is different from Italy, and Italy is different from Germany. They're slowly trying right now to build a European system because of the EU. But besides that, it's still very different. For instance, we have advanced providers responding in the field, a lot more over there. We have squad cars or QRV, quick response vehicles, that have physicians on board or trauma surgeons. Sometimes they even have anesthesiologists to come to the field. So that's a very different system, basically. But at the same time, Italy also has a lot more BLS providers than ALS. A lot of the ambulances there tend to be BLS, and then you have these quick response vehicles with either a paramedic, a nurse, or physicians even on board. And when it comes to the air side, every helicopter has a doctor on board.
Wow. Okay. All right. And like I told you, I did a lot of research because it was involving paramedics, even though I'm not a paramedic, it was involving paramedics, and it was dealing with the type of education that they received.
Yeah.
And so I was trying to do a comparison, and because EMS is still in its infantile stage for research, but we are definitely growing greatly. Okay. A lot of it came from the nursing side, and we took a lot of that research and worked with it. And now we're trying to do our own research, and we're looking at everything so we can build a better EMS system collectively. But one thing that I did find that was very intriguing is the physicians in the field. Now, I know that there's some here in America, but it's not probably treated the same way as it is over in Europe or even Australia or even in Germany, where I read several reports. How do you think that influences the care?
It brings more aggressive protocols to the field. And also the paramedics in Europe, we all have to have a 4-year degree. So there's also the difference there. So all of our protocols and everything are a lot more aggressive. There's a lot more than we can do in the field. But at the same time, we see that we don't do it as often. Here in the US, it might be even like a waste of resources to have the physicians in the field. I would rather have more like critical care medics, advanced providers in the field. In Europe, I've seen it all the time. The physician shows up. There's not much he can do in the allotted time that we have. Yes, on paper, it's great. But how often do you get to do a field amputation? Or how often do you get to put a chest tube in the field?
I got you. Yeah. I got you. I understand you now.
It's a mix of both worlds. When I came over here, I was surprised that physicians were not in QRVs. I was like, how do you guys even do it? But then the scope of practice of paramedic, you learn that it's sufficient. It's actually excellent what we have here too.
Okay, excellent. And that's where I was going to go to. You're deep into advancing EMS practices.
Yes,
absolutely. And with you being here in the United States, could you just discuss maybe an initiative that you've spearheaded or that you are trying to make an impact on improving patient care or even operational efficiency?
Yeah, absolutely. So it all starts with improving how our providers are in the field, their quality of life. We want to make sure they're well taken care of so that they can take care of the community. So in the past 20 or so years, the EMS community has all been saying to people, if you need us, call 911. Doesn't matter what it is. We're going to be there for you. And I agree with that statement. But at the same time, that has increased the call volume exponentially, leading for a lot of EMS providers to burn out and leading to hospitals, EDs, emergency departments to be overwhelmed with patients with lower acuity complaints. So EMS has become a way for the community to access healthcare rather than being an emergency medical service at this point. And I see nothing wrong with that. But the problem is we're not able to satisfy the needs of our community. So I'm very happy that in the past 2 to 3 years, I've been working with AMR, or American Medical Response, who's spearheading a program from the federal government called ET3, which stands for Emergency Triage, Treatment, and Transport. This program allows ambulances to transport patients to other destinations than EDs or emergency departments. For example, we can take patients to urgent cares, or even telemedicine or telehealth as well. So a 911 crew can show up to somebody's home, and if the crew determines this not to be a life-threatening situation, or maybe somebody needs a prescription refill and they don't really need to go to the hospital, they can connect on their own iPad, on their own computers, to a physician. This is a great program. And the physician can actually help the crew do the assessment. They can see all the vitals that are being taken, all the EKGs, and take the medical history. And if needed, they can fill up the prescription for the patient, or organize a ride with a rideshare service for the patient to go to a clinic rather than the emergency department. Because we all know,
that is incredible.
Yeah, oftentimes, if it's a low acuity complaint, the ambulance crew is going to take him to the ED. The patient is going to get registered and then put back in the lobby. And God knows when they're going to see a physician. If they're going to see a physician even, you know?
And I'm glad you said that, because no names. Someone stated, I know if I call 911, I will be seen quicker. That's what a lot of people are saying. That's why they're calling it. And I can be corrected. But when I'm in the ED, they take the most critical.
Yeah.
They have to.
They're still triaging.
They're still triaging. We understand 911 is there. We're excited that it's there and we have it here. However, they still have to, like you stated, it's the ET3. There's a form of triage. And so triage is important. You know, I haven't even discussed triage to a lot of people. And the ET3 sounds very interesting. So go a little bit deeper.
Yeah, absolutely. This is actually a program from the federal government. It's from the Center of Medicare Services. They are seeing how impacted the EMS system nationwide is, and also how the hospitals are impacted by this. So the federal government is actually trying to implement this program. Now, ET3 was a pilot program. They started talking about in 2019, kind of took a pause because of the COVID pandemic, but then they got up again and running. And I was actually lucky enough to have been chosen by American Medical Response to implement this program in 2 of our counties here in California, for Santa Cruz County and Monterey counties. It has been a great success so far. A lot of people have managed to get better access to healthcare by using this program and get redirected to urgent care clinics, or even other clinics, or go to their doctor or get the prescription filled. Now we are trying to take the next step here at GMR or AMR, which is another program called nurse navigation. So we're going to have a nurse at our dispatch centers who are going to be able to filter out 911 calls and the low acuity complaints. And from that point, even take care of the patient's need right there and then, send a ride share, schedule an appointment. Now, of course, if the patient needs an ambulance, they're going to dispatch an ambulance too, but that can also be triaged to whether they need to send a critical care unit, an ALS unit, or a BLS unit. So we're trying to find ways to help people access healthcare in a way that benefits them, because we've all been seeing that just going to the ED doesn't solve people's problems. It just impacts the system so much. It leads to longer 911 responses because ambulances are busy in the field. It leads to crowding at the emergency departments, and it leads to our employees' burnout as well, because they get ran all day for multiple hours for lower acuity complaints too. So I know a lot of paramedics just want to run all the critical calls, but when reality hits, it can burn them out as well. So we want to help everybody here. And so far, it's been a win on every front.
Okay, so you brought us some really good information. The nurse navigation. Is there follow-up?
Absolutely. Here at GMR, we have follow-up from either the nurse that picked up the call, our physicians are able to follow up. We have contracted with an entire group of physicians as well for this very reason. They're nationwide. They're certified in whatever states they want to operate in. They do all the follow-up and they communicate with the patient's personal physician. And we are taking a huge part of the continuum of care. And as a clinical specialist myself, I can also follow up with the crews and help bridge the gap between the field crews and the physician group.
Well, I like this. I like this. I'm hoping this is going to pique the interest of other organizations who are in
Absolutely.
the EMS system. And it's not just EMS. I mean, you mentioned nursing. We're working with our nurses as well. And this is
Yeah.
amazing.
We are all on the same team. Patients need all of us. From the EMT to the physician, we all want to
Yeah.
take part in the continuum of care for each and every patient so that we're able to properly integrate healthcare with the community, with their needs. When people call 911, they don't necessarily need an ALS unit to go to the emergency department. That leads to ED overcrowding, as I said. Unfortunately, patients that have a lower acuity complaint can take hours before they can be seen by a physician. Sometimes they don't even get that. They get a nurse to discharge them and they haven't solved the problem. They might have put a little quick fix, but we have not solved the problem. And they're going to go home. Maybe they're going to follow up. Maybe they don't have the resources to follow up.
So for the audience, I just want to break some words down because we're using a lot of acronyms. When he mentions GMR, I think you're talking about the Global Medical Response.
Correct. Global Medical Response is our parent company. They own AMR, which is American Medical Response, and we have other companies, including AIR. We're a nationwide company. I can use those two terms interchangeably usually.
The other thing that he mentioned was BLS, which is basic life support. And then you have ALS, was it advanced life support? Sometimes you will hear the interchange of ACLS, that is dealing with the cardiac life support system, where we're focusing on more cardiac. I'm just going to break it down because you're giving such good information that the community needs. When you go to CPR training, we're giving you pretty much how to look at things in a very generalized fashion. Then there's another level in like CPR, which is BLS, basic life support, just making sure we're meeting the needs from the patient for their airway and their breathing, making sure they're breathing properly. And we go one step further because we deal with our teams. Then we have ALS, which is the advanced life support, where there is more training for the person who is there in EMS. And it goes much deeper where we even go into ACLS dealing with the cardiac and how we can deal with the heart. And that's where we deal with more of the paramedic. ALS can, depending upon where you are, can include the advanced. There are some intermediates that are out there and some enhanced that are out there, but that is no longer offered so that you can go into the EMS field. Enhanced and intermediate are no longer offered. You can get EMT, which is an emergency medical technician, advanced EMT, or a paramedic. That's what's offered here in the United States. And I just thought I'd break that down because I think that's important. And you hear those names interchangeably. And the more that I speak it, the more that people can become more familiarized with it. And you're giving us this, Alex, the breakdown. And I thank you.
Yeah, for sure. And there's also each state has its own different things. Here in California, we do not recognize advanced EMT. We only have EMT basic and then EMT paramedic.
And see, that's the other thing I just mentioned. I said it depends on where you are. So Alex just broke it down even further. So y'all don't even test for an A?
Nope.
So when someone comes to you, and do you have reciprocity there?
No, for EMT advanced.
Okay, so they would have to take a test?
They would have to be EMT basic or go to paramedic school.
I think we just helped somebody.
Yeah, I know, right? Absolutely. And we have the highest EMS professionals in the nation. Yes, cost of living is high, but we have the highest paid EMS professionals in the nation. I'm here in Silicon Valley. I live in San Jose, California. The operations that I work for is AMR Santa Clara because Santa Clara is the county that we're sitting in, 30 miles out of San Francisco. Yes.
Wow. All right. Balancing your career, emergency medicine, finance, real estate. I'm going to be honest with you. It's very impressive. Okay.
Thank you.
I love it. I love it. I love it. Now, there's a way that all this integrates because we're dealing with communication.
Yes.
We're dealing with knowledge of finance, which is numbers, and numbers is all into EMS. How do you use your diverse skill set as well as your experiences to innovate the healthcare industry, or how are you integrating all of this in to your current role?
I speak up. I'm very happy that GMR has given me the opportunity to work up to where I'm at right now. And the biggest thing, as they said, is communicate. Talk to my leaders, bring up ideas. I can get a few no's here and there. It happens. But if I ask a question, the worst thing that can happen is them saying no, right?
Yeah.
But then I can bring more ideas and I can bring more data. I'm a huge data person and I like crunching numbers. I go in the different call logs. I see what the patients needs. And then I develop reports and I bring up to my superiors. Luckily enough, our leadership here has been nothing but amazing. So I've been very, very happy. And our leadership here in Santa Clara specifically has also started a mentorship program for paramedics. They go from the field to go more into leadership positions as well. So they're also helping us grow as well because GMR wants to innovate. This company has changed a lot in the past 5 years alone. We have learned, and it's not the good old GMR or AMR, whatever you want to call it, that a lot of people have known in the past. No, every operation is different, but I see a lot of positive change here. We want to innovate. We want to change. We want to do better because our community deserves it.
So are you the KPI guy?
Yes.
Okay.
I am. I'm the guy with the smart sheets and Excel sheets. Yes, that's me. Quality improvement. Yeah. I do also all QA and QI as well.
You do? Okay. That's what I was going to ask too.
Yeah.
Okay. So you're really getting the whole picture. So oftentimes when I have EMS on or anyone who's in a field, we're always talking about, we call it boots on the ground.
Yeah.
But what you're doing is we're taking you behind the scenes now. Alex is behind the scenes, but he also has boots on the ground though too, y'all. Hold on a second. Let's pause and pump the brakes. Because he just got off shift last night too. Both of us did.
That's right. I got off a minute.
Right.
I really believe in leading from the front. And that's basically one of the reasons I pick up shifts. I want to see what's going on in the field. I want to experience it. I came here to AMR Santa Clara as a brand new leader. The field did not know me at all. And you know how easy it is for the field to just roll their eyes and be like, here goes another admin position. I'm like, no, I'm a paramedic. I'm here with you guys. The uniform on, and I go out there in the field, either on an ambulance or a quick response vehicle. I like training, I like teaching, and I like experiencing what the field experiences every day. Now, I cannot be full-time on an ambulance. I only pick up during the weekend here and there. But I want to see what they're going through so that I can report that back. So that I can be like, this is exactly what they need. I communicate their needs a lot better because sometimes the field doesn't communicate their needs well. There's a lot of chatter, among the medics and the EMTs in the field, but part of gaining their trust as a brand new member of leadership is to be there in the front for them, show them you can do the job, show them that you listen to them and that you value their opinion. So at this point, we can finally see people coming to us, bring us ideas, bring us problems that we didn't even know existed. So I really believe that.
Yeah, our boots were on the ground last night, definitely. And you were too. Friday, Saturday, and Sunday. People think, oh, Sunday, remember laid back and relaxed. I don't know where that came from. Not 2024 anymore, but we were nonstop.
Yeah, yesterday I ran from noon to midnight and I ran 11 calls. And all we do here is 911. We stayed pretty busy.
Yeah, and see, we do distance, and so they kept us nonstop as well.
It's even more exhausting than distance.
Yeah, because you still have to monitor the patient for at least an hour or more. So,
and then you got to drive back, which is just as exhausting.
Yeah, exactly. Drive back to get the next one.
Yeah,
that's what we're doing.
There's another misconception where people think, "Oh, you're on a call and that's it." It's like, no, we move between different posts. We drive miles and miles and miles every day, even if we don't have a patient on board or not responding to a call. Yeah. So that also brings up the fatigue argument that a lot of field employees are seeing.
Oh, but that's a whole nother interview. We could talk about that. I would love to get all the EMS together and talk about the fatigue part.
Absolutely. Burnout and fatigue is huge.
Right. And another thing that was quite interesting when I was speaking to some friends of mine, they were like, report. I was like, yeah, we have reports to write. It's not like, somebody says, hey, can you write this report and give it to me in 24? No, your report has to be done before your shift is over. And preferably within the first 20 to 30 minutes, and it's a legal document. After the call is over, it needs to be completed.
The longer you take, the more you forget. Especially if you keep running calls all day.
Yeah, I give it to my paramedics. I mean, they have a lot to put in because you're remembering everything you can think of from top to bottom. Now, speaking of that, traveling, being in the community, you've got to tell me a little bit about this experience of overseeing the medical operations at the sports arena, the sports team. That is impressive. You said Minute Maid Park for Houston Astros?
Go Astros. Go Stros.
This is a large-scale event. What's going on?
Including 2 World Series. when I was there. Yeah, Minute Maid Park gave the contract to Acadian Ambulance, which was my former employer there. And when I was a supervisor, I was tasked to go to these games and set everything up, basically. So I was there as part of Acadian Ambulance, which, by the way, it's another great EMS company. If anybody's in like Texas, Louisiana, or Mississippi, absolutely. But yeah, we had the contract for Minute Maid Park, and we had to set everything up. And of course, at the beginning of the season, not much going on, right?
Right.
1 to 2 ambulances are more than enough. But then, as the Astros were doing pretty well, let's just say, I don't want to brag too much, but it got more and more challenging because then you have to coordinate the medical response with a lot of other different agencies. And, the more you go up, the more attention you get also from the federal government to get involved. All the 3-letter agencies are there. You have the FBI. You have to coordinate everybody, and you are the medical team.
Oh, wow.
So we had ambulances for the crowds. We had ambulances for the staff. We had ambulances for the teams. So there was a lot of movement, and we did not really get to enjoy the game. Once you're there, you're just working, and you get busy. Minute Maid Park is a huge stadium. It has a lot of people there, and they party hard. They do party hard. They party hard. So they were busy. And one of the biggest challenges is once the units in the stadium get busy, having to backfill the system because there is no way you can let the stadium without an ambulance. So as soon as a unit got a call inside the stadium, I would reach out to dispatch and get another one sent to backfill. And that always has a huge impact in the system because then you start taking units from their station, taking units from their posts to backfill in the stadium.
Yeah, because then that affects the community as well.
Absolutely.
While you're having the game, you still got the community living.
Yeah, exactly. That is a huge impact. So you have to prepare to get more people to work the day, put extra crews, extra trucks out, besides the ones that are dedicated to the game themselves. So it's a challenge, coordinating everybody's schedule, calling in medics that are already tired, already fatigued. Yes, you can entice them to watch the game, but we all know that doesn't really last long. Yeah. No. We all know. Yeah.
Not at all.
But there's a lot of challenges and a lot of coordination involved.
Wow. I just want to say, Alex, this has been an impressive interview. Thank you.
Thank you for having me. I love EMS. EMS, everybody, they're my people. And I love sharing my knowledge and I love to take part in these interviews and just get together. This is another great opportunity to network. Get together. Let's share all of our experience. All your guests have been amazing as well.
Thank you.
And what you do is also really great. I really appreciate you.
Oh, thank you. I love it. I love it because I learn in the process as well. And that's what I want. I want everyone to learn what I'm learning because how are we going to improve?
Exactly. There's plenty I got to learn still. I learn stuff every day.
Right. Yeah. If you're not, you're not on the right bandwagon.
Exactly. There's stuff that I learn every day. Yeah.
I thank you so much. If I have anything else, I definitely will be inviting you because I'm sure our audience is going to be like, give me more of Alex Este. We want to hear more. And I know that I do. I thank you so much for joining me on Cold Press Conversations. I cannot let you go without telling me. Mm-hmm. Are you familiar with cold press juicing?
Oh, yes. Absolutely. I'm Italian.
I thought so.
Come on.
Ready? I got to know it. So what cold press juice will I be naming as the Alex Este cold press juice?
I'm going to be honest with you. I'm more of an espresso kind of guy.
Are you really?
I am, yes. I like a little tiny cup of espresso. In my office at work, I have 2 espresso makers. And all the crews come in, just get coffee with me, just chat, share their experiences, and we all have coffee together every morning. That's like a ritual that we have here. So,
okay. Yeah. All right.
So,
but you still drink your water though, right?
Yeah.
Okay. Yeah. I was going to say, have your glass of water.
Yes, absolutely.
Important.
Hydrate. Yes. It's going to get hot today. At least where I'm at, it's going to get really hot today. And heading in the summer, reminding everybody, hydrate.
Yes. Not overhydrate, but still hydrate. Take it with ease.
Yes, for sure.
I thank you so much. I appreciate everything.
Absolutely. Thank you for having me once again. I'm really thankful for this. And thank you for all your efforts in bringing the EMS community together. It's really needed. It's absolutely needed. We are a very small community, but at the same time, we're not that connected. It's so easy to get drawn into the day-to-day busy work. That it's super easy to also forget about the other systems and what's going on out there. So it's very important for us to take the time and have a talk. And I would love to hear back from your audience as well. You can publish my contact information. I would love to take questions personally too. I do not mind. I want to hear from people.
Awesome. Awesome. You want to give them some contact information right now? Something that's quick and easy, you think?
Sounds good. So my email is alex.aste, my full name, @gmr.net.
I hope you enjoyed this episode of Cold Press Conversations. If you love this episode as much as I did, I need you to head on over and subscribe so you never miss an episode. This is Dr. Jewel signing off to health and cognitive happiness.